Hello, I'm Charlotte Jackson, President of the Camellia Rose, Georgia chapter of the Links Incorporated. And on behalf of our chapter, I'd like to welcome you to our Linkages to Life webinar. Linkages to Life is a signature program that supports the maintenance of good health and the elimination of health disparities in the African American community by supporting organ and tissue donation. And tonight, our panel of experts will do just that. They will talk to us about organ and tissue donation and provide us with life stories, strategies, and beneficial information so that we all can make a good decision about whether or not to donate tissue or organs to help save the lives of others. Thank you for joining us.
Good evening. I will serve as your moderator tonight. My name is Dr. Javonda Hodge, and I am a surgeon working here locally at Grady Hospital. I've been at Grady for the past 14 years. Went to college here in Atlanta at Spelman College, and just never knew I'd come back. I am so excited to moderate our exciting panel of guests who all have one thing in common. They have received the ultimate gift of life from a generous donor family. I first want to start with Mr. Bobby Howard, who received a kidney transplant. He also is a director of the Multicultural Affairs for the Lifelink of Georgia. He's very involved in the community. He's the 100 Black Men of DeKalb County. He serves as the NFL Players Association president, the Atlanta chapter. He's involved in UNOS, which is the United Network of Organ Sharing, on their board there, and has been active as far as pushing diversity efforts within the transplant community. Thank you, Mr. Howard, for joining us.
Thank you for having me.
My pleasure. Our next panelist is Ms. Lavette Russell.
Hello.
And she also has received a gift of life. She's received a lung transplant. She is a native Atlantan and has been in the community for a long time. She is, as she did know, she is my Spelman sister, so I will say welcome on that front. She is a senior consultant with Cox, Curry and Associates, and she provides consulting to nonprofits as far as strengthening capacity in the critical areas of board development, volunteer engagement, and fundraising. She's on the board currently of Zoo Atlanta and Children's Healthcare of Atlanta Foundation. She has chaired many society and social events in the city, including the Mayor's Mass Ball, Atlanta History Center's Swan House Balls, Zoo Atlanta's. And she's active in the community just because she's a Spelman woman. I know that's what we do.
Right.
That's what we do. And she is here to share her passion about organ donation as well. Our next panelist is Ms. Morgan Reed, who also is a donor recipient. Good evening, Morgan. Thank you so much for joining us. She works with the National Kidney Foundation as Director of Transplant Policy and Strategy, which she started with them, I think, 2021. She helps to create policies that promote, again, equitable access to kidney transplant procedures, as well as healthcare after receiving a kidney transplant, which is some of the things we don't talk about as much. After you get your kidney, how do you keep it? So we need people like her on the forefront, kind of pushing for diversity and equity in that space as well. So welcome, Morgan. And she has a lifelong experience with transplant, and actually one of her friends gave her a kidney. So she is a living donor recipient, which is something that's even more special. So to open up, I want to ask each of you, like, what made you, come forward and talk about organ transplantation, and why is it important to spread the message to our community?
You want anybody to start, I guess?
Anybody, just jump on in.
I'll jump in. I thought it was important because it was down to the wire for me in terms of being matched to get double lungs. And so it clearly saved my life, knowing that someone decided to donate their lungs. And when you feel like you're in the last couple of months of living, you are praying that there's a match. You're praying that people donate. And one of the things that I said toward the end was I would make sure that I spoke out about that, especially among Black people, because there are so many myths that are out there. There's so many things that we are skeptical about. And I know that doing this could not only save one life, it could save many lives. So that's why I decided to make it my mission post transplant.
And let me just add that lung transplants are some of the hardest to get.
Mm-hmm.
Um, to donate your lungs, you have to really be in pristine shape,
Mm-hmm.
and you can't give your lungs and like still survive. So the patient has to go on to, it's not like a living donor with a kidney or even a liver
Correct.
now.
Mm-hmm.
So lungs are some of the hardest to get from donors. So it's even rarer to have a lung transplant, to be honest. And as far as managing donors, those are some of the first things that if a person's been in an accident, that their lungs may go first, just from the
Yes.
trauma of the injury, and then may not be suitable for donation. So the fact that you got that call um, is just a blessing. And
Yes.
I don't know
Yes.
if you realize how much of a blessing that is, but for people that are waiting and waiting and waiting, what is it like to get that call?
Oh, no, I mean, I recognize what a blessing
Yeah.
it was because I was told that there was about an average wait. The hospital that I was transplanted is University of California, San Francisco. And the average wait I was told was about 7 to 8 months. I waited 19.
Yeah.
So for me, it was getting more and more stressful by the month. And so yeah, it to get that call was such a blessing. I had a couple of dry runs, and I don't know if you know what that is, but that's when you get the call and you get to the hospital, your mind is there, you are excited, and then you find out that for some reason the match has come through. And it's not always it's a match. You know, I only had one dry run, and I will tell you that this is important too to know. The family members were not in agreement with the person that was transpiring or going on. They were not in agreement that they should give their lungs, and the mother wanted them to donate. The father did not. It got to be a whole big mess, and time ran out. So for me, I'm laying there waiting. This person is expiring, and that was a really big issue. But the second time around, which was about 4 months later, I cannot tell you how ecstatic I was. And they tell you to expect a phone call to answer any call that comes up. You never know where it's going to come from. And I did at that point, not even thinking about it. And the lady called me. It sounded like a sales call. And she said, "Hey," I mean, seriously, she said, "Hey, hi, Levette. How are you today?" And it was about 5 o'clock that evening. I was like, fine, thinking she was going to go through the spiel. She said, "Well, how are you feeling?" And it was the way she said it. And I'm thinking, I'm feeling fine. And she said, "Well, have you been sick lately? Do you have a temperature?" I was like, "Who is this?" And really with some attitude. Okay, with some attitude. And she says, "Well, how are you feeling?" I said, "I feel great. Who is this?" And she told me she was from, I don't know if she said UNOS or she said, "But guess what?" She said, "I have two new lungs for you." And I cannot tell you, the tears burst out. They were projectile at that instant moment. And my son had just come in from Atlanta to visit me. He was standing there in the room with me. And I mean, from that moment until I was going into surgery, I almost don't remember things because it was an out of body experience. I was so happy, so excited. I was so super sick at that moment. I prayed that things would go fine with the family and the donor, and it did.
That's amazing.
Morgan, do you? I know that you had your. You're right.
Yes.
Something.
So my best friend in college donated her kidney to me 15 years ago. January 9th is our kidney bursary.
Mm.
And she asked me twice if she could donate her kidney to me. The first time I told her no because I could not reconcile not being able to pay her back for doing something so magnificent for my life. it was very difficult for me to consider accepting a kidney from my friend. And 6 months later, she came to me again and said, Morgan, if I can give you a kidney, I will. And that time I just assumed that that was God saying, girl, I'm gonna throw you this lifeline one more time.
Right.
And the way the transplant process works when you're a living donor is the recipient cannot help facilitate that process in any way. The transplant center wants to make sure that anyone that's donating an organ is doing so on their own accord, that they're not being coerced, that this is something that they truly, genuinely want to do. And that is what I shared with my friend. I cannot facilitate this for you in any way. Here is the number to my transplant coordinator. And I have to tell you, I was a little skeptical because I had brothers and sisters and family and cousins that I thought were going to be a match for me, or I thought that they would go through with the testing and they didn't. So having someone else say, oh, I'll call, I wasn't sure if it was going to happen. But Kelly is her name. My friend Kelly went through with all the testing. And a couple of months later, we found out that she was a perfect match. So again, January 9th, 2007, I got my new kidney. And I knew from that moment, I volunteered with the local organ procurement organization in New Jersey where I live before I received my transplant. So while I was on dialysis, and I was on peritoneal dialysis for almost 2 years before receiving my kidney. But I knew when I got my transplant that I was going to have to dedicate my life to this mission, because this is how I honor my friend every day.
Mm-hmm.
This is how I give back to her for doing something so selfless and courageous for me. So I have worked for 2 organ procurement organizations. I have worked for Emory Transplant Center, and now I'm really excited to be the new director of transplant policy and strategy at the National Kidney Foundation, really just trying to give someone the same chance that I have had, another chance at life. So that's really important to me. And then, as Lavette stated earlier, in minority communities, we don't really think about donation. We don't talk about organ donation. We really don't talk about our own mortality. We don't talk about our own death. And for me, being a kidney failure patient, a dialysis patient, you can roll through any neighborhood in America that is underserved and see lots of dialysis centers.
Mm-hmm.
And I want people to know that dialysis is not an endpoint for kidney failure. You can be transplanted. So this is my life's mission. I'm so passionate about this work. So I'm excited to be on this panel with Lavette and with Bobby and with you, Javonda, because this is what's important to me.
We feel everyone's passion. I'm going to give Bobby a chance to speak in, since you work directly for LifeLink, and give us an update as far as what are they doing to diversify their efforts as far as getting word out in our community.
Well, one of the great things, and I can only echo what Lavette and Morgan stated. I think when you are a person who's in need, and you are basically told that if this doesn't happen, if someone doesn't love you enough, that your life is over. And when you go through those processes and you sit down to reflect on what life is all about, you learn to appreciate and value life a little bit more than what you did beforehand. And so going through that whole process myself, and, being 27 and a half years out with my kidney transplant, it's just truly an amazing journey. And as you sit back and you say, why do I give my life to help others and help people that I don't know? It's because you have been rejuvenated and you have a new lease on life, and you look at life differently than what you did in the past. Mm-hmm. And in my 27 years of receiving my transplant, I have been working with LifeLink of Georgia for a little over 27 years as well. And it's truly been a journey working strictly with the Black community and the Hispanic community as well. But to see the transformation, and when I first started with LifeLink, of the number of people, when I walked down the street, they didn't want to say a word to me because they knew what I was going to talk about. And that's just what it was. But the transformation over the years, to see Many years ago when I first started was, Black people don't donate. You got to go to the church. That it's a religious thing. All these things, they're in fear of, if they're in an accident, that no one's going to save their life and let them die and take their organs. All those obstacles that were out there. But I am proud to say at LifeLink, we have done a very, very good job here in the state of Georgia with educating our Black and Brown communities on the importance of organ, eye, and tissue donation. Because you see, especially with kidneys, there's a matching that happens that a lot of times, in most cases, it's best that your kidney comes from someone from your same race and ethnic background. So when we put a lot of effort into educating our community and give them the true facts about life and give them the true facts about our overall health, that on one end, we're the greatest community in need, and on the other end, we're the lowest community who's willing to put in to the system. And I always say, if you don't put anything into the system, you can't take anything out of it. So by putting into it, now you see more people like Morgan, and you see Lavette and myself, and there's countless other people here in the state of Georgia and across the country of color who've received transplants. So it's vitally important, and what we're doing at LifeLink in my department is partnering with other organizations, community organizations, and churches. And it's great to be a great partner with you guys, the Links Incorporated, especially Magnolia chapter, of what you guys do in your Linkages of Life program that helps us get out the word, because we can't do it all by ourselves. We need pioneers and people who say, wow, this is a great cause. I can get behind this cause, because it's all about life.
It definitely all is about life. And I could speak, just people wondering, if I come in the hospital and my donor card is signed, they're just going to take me off life support. That's not true. In fact, when you come in the hospital, when you come to Gradius in an accident, everyone's under an assumed name. So everyone gets a stat, we call a stat pack name. It could be Morgan City 2000. And you're not identified until someone else can identify you. So we're working on you constantly without knowing who this person is, because we don't go by IDs in your wallet, because it could be wrong. The age could be wrong. You may not have any ID on you. So everyone who comes in as a trauma patient gets a stat pack name. So we don't know what the person's real name is. It may take a day to find out, 2 days, but we're already still working on you without knowing who this person is. And it allows us not to have the confusion of having someone with the wrong name, with the wrong body. So the whole thing, they're going to look at my wallet and see the card. Even if we see the card and it looks like you're not identified as that person until someone else could also identify you. So we go to save your life, at all costs. And that's our first mission. Our mission is to save lives. I think the hardest discussion that we have when we see patients who come in who have a fatal injury is kind of admitting defeat. But the gift organ donation is able to turn that defeat into a victory for somebody else. It is sad for the family, but having them transition to become a donor family is one of the most humbling things that I've seen. Having someone say, yes, I have suffered a great loss, but I know this loss can help somebody else.
Yes.
And it happens every day.
And Javonda, not to cut you off, but I think what's vitally important as we go through this journey, that's the importance of reaching people before they get into the situation.
Yes.
And it's so important that as we tour and go through all these communities, and sometimes you look at, you go to these different hospitals, and sometimes people have a preconceived notion when you look at someone and say, well, this person or this family's not going to do this person not going to do that. And I really try to work with, our staff at LifeLink and other folks around the country to let them know that we have to treat people as human beings. It doesn't matter what background they come from, because we're all in need of something. And it may not be organs, but there's something that we're all in need of. And we have to think of people when they're in dire situations, is that could be our family member in that same situation. And how would you want your family members to be treated? So it's real important that when we talk about just all type of health issues, is that we really put a strong effort into reaching people before they're in need. And that's the daunting task. You have the hospitals all around when you get sick or you have a horrible accident. We know that you're going to the hospital, but we have to prepare people when those things happen. What are the steps and what can happen? So when you're there, at least you have a little knowledge, so you're not just hit with all these things and you have to make this decision. And that's real daunting and horrifying for a family. So it's real important of the education aspect and getting out in the community and spreading the word.
I mean, Morgan, I wanted to ask you a question as far as working with policy for the National Kidney Fund. I know that we've seen minority donation rates go up, but they still are not the same rate as our white counterparts. The other question I have is, how are we addressing disparities that occur after you get your transplant, as far as not being able to afford medication or ability to access healthcare? How is the NKF like helping our patients kind of get to the other side and have a successful transplant?
So we definitely have some legislative and policy priorities. So from a policy standpoint, we are focused on increasing deceased and living donation education. The way that we would like to do that is to create policy that requires transplant centers to go out into their community to talk about living donation. We want policies that encourage organ procurement organizations to get out into their DSA and talk about deceased donation. We want to see organ procurement organizations focusing on cultural sensitivity training so that the people that are requesting donation from families can talk to families from all walks of life. We want to expand access to transplantation. Health equity is a very big focus for us at the National Kidney Foundation. And it's difficult because, I mean, it's very difficult when you're dealing with racism in healthcare, and there are unconscious and some conscious biases when it comes to transplantation, when it comes to organ donation. So, those are issues that we're focused on too. I can tell you that we are currently drafting legislation to eliminate barriers to transplantation for certain underserved communities prior to transplant and after transplant. It is a bill that we're currently socializing at this time, but we do have legislation that we're working on. Again, another policy priority for us is to make sure that healthcare is more patient-centric. So there are things that we're focused on. And what I mean by patient-centric is making sure that transplant centers are including patients in their healthcare, talking about all of their options, allowing patients to become active participants in their healthcare, especially when it comes to minority, underserved, and rural communities.
I want to bring Livette back into the conversation. When you talk with your transplant physician, did you feel any barriers talking to them or accessing care? Did you experience any of that in your transplant journey?
No, I did not, but I ended up at my transplant center with a recommendation from my scleroderma doctor. So just being very open, I have an autoimmune condition which caused me to have pulmonary fibrosis. And I have scleroderma. So I had a great scleroderma doctor that brought me into the fold at UCSF. So they were very welcoming. I will say, though, that the process that they take you through, which is well worth it and needed, when you get on the transplant list, they want to interview those that are in line to take care of you. So they want to interview the primary caregiver and a secondary caregiver. And I wasn't so sure, they wanted to see both people in person, which meant I had to fly them from Atlanta. We were in San Francisco. And I didn't feel so sure that this person felt real good about who I was bringing in. And there were some transplant, others that were waiting on the transplant list that I had befriended while I was there. I just didn't feel like they got the scrutiny that I got. I don't know why that was the case, but I felt like they scrutinized what I did and who was taking care of me a lot deeper than others around me. But fortunately, I did not have a doctor that I felt looked at me any different. Um, Going back to another point, what I will say is part of my motivation now in talking about organ donation is that with scleroderma, even though I've gotten a double lung transplant, one of the things that they made me very aware of from the beginning was that once I got my lung transplant and I started on the drugs that I needed to keep these lungs living in my body, that within 5 to 7 years, I need a kidney transplant. And so my kidneys have started to fail. And I know that that's something pretty soon down the road. So not only have I been preaching about lungs and getting that as a gift, but I do know how important kidneys are. And Bobby can tell you, Bobby knows this. 16 years ago, my husband received a kidney from his brother. So we're one of those rare couples where both of us have been transplanted and we know how important it is. My life, I feel like it was great because I saw the setup and the things that happened prior to Michael, my husband, getting transplanted, which prepared me for what I would go through. So I've been there before with the kidney transplant, and I know for sure that these lungs are going to keep me around for a while, that I'll receive a kidney transplant and be able to rock and roll because of the gift of life.
And Bobby, can you also speak to like as far as disparities in the transplant industry, organ procurement organizations, or OPOs as we call them, and what changes have you seen over the past, let's say, 2 decades?
Well, things have changed, but I will agree is that things are still there where you have race and all those things. And, I know myself, when I went to get evaluated and, I always remember the question that they asked me, say, well, what are you going to be doing 3 years from now? If you got the transplant. And I asked Papa, I said, what are you going to be doing in 3 years? I said, give me the kidney.
Right. I like that.
Give me the kidney and we'll work from there. And, and I thought, but as I thought about it, I thought that was an unfair question to ask me, what am I going to be doing 3 years from now? I didn't know if I was going to be on earth or not. But when I would ask people who were not of color, they didn't get that question.
Mm.
And so I started seeing a little different things, and that's why I do the work that I do. And there's a lot of things, and it's hidden. And one of the things that what's supposed to happen is when you go on dialysis, before you get on dialysis, you're supposed to be given all your options about your care and donate. I mean, transplant is one of those options that you're supposed to be educated about. But what's happening is that here you have this patient who's traumatized, just been told they have to go on dialysis. And that question sometimes can be phrased, you don't want a transplant, do you?
Mm-hmm.
Interesting.
And that's to the gist of it. And that's it. So you have this patient sitting there saying, oh, no, I don't want that. So they've done their job. They check that box and they say they've educated. But then when you ask the Caucasian folks who are on dialysis, they get a full-blown education aspect of the donation process. I mean, in the transplant process. So there are things that are different. It's getting better, but it can be a lot better because even in the OPO world, when you start looking at diversity and inclusion, it's very disheartening when you have these 57 organizations and you have 3 people of color that are in leadership. And then you have no one else in the pipeline to be there. And then when you have all of your staff and then you have your few people of token colors around to say, okay, now we need to increase this donation in the Black and brown community. But then you really don't put the efforts into educating the community. You just go to hospital and say, do you want to do this? Do you want to do this? And you get families to say no. So now you have the side effects of that is that we wait a lot longer for transplants. And it's unfortunate. And like I said, things are getting better, but it's still there. It has to improve a lot faster than what it is. And it's thank God, I've known Morgan for a long time. I've known Livette for a long time. And actually, and I hope you don't mind, but Livette and I go further back than her husband, and I'll share with you briefly. Livette has a very good friend whose husband was in a tragic car accident.
Yeah.
and he was on life support. I mean, he was on a ventilator, pronounced brain dead. I was the one to talk to her family, her and her mother and father, to see if he was a donor. While we were talking, she said, "Well, his name was Stan." She said Stan would want to do this because one of his friends is going to need a kidney, and they were talking about giving that kidney. That friend was Levette's husband, Michael.
Oh,
That's
wow.
how we got connected.
Mm-hmm.
And it's been, and Stan has a daughter, Jillian, and I just saw Jillian a couple weeks ago. Jillian's graduating college, but at the time she was
Next
6 months
month.
old.
Yeah, she was 6 months old.
She was 6 months old. So,
Yeah.
How this thing works, it's so, I tell people it doesn't end. Just because it hadn't affected you today doesn't mean it won't affect you tomorrow.
Yeah. And it's such a big circle because that was the first time that I was ever faced with that issue in my tight circle, right? When Stan passed away, he was brain dead at that point, and Judy was going back and forth about, do I donate? She was learning from Bobby, who was wonderful through the process. And for me, I saw how important it was. If I remember correctly, Stan's organs went to 8 different people.
Mm-hmm.
And that's touching a lot of lives. And I think a lot of people don't even recognize, well, it's very rare you hear about lung transplants. I never heard of that. But you hear about kidneys all the time, but people don't realize you can transplant your corneas, your skin, all these other organs, and all these other, there are so many things that can come out of one person that could go to so many people, and it's so powerful. But I also got a lesson that that weekend with Stan's mother, who definitely knew not a lot about organ donation and was very fearful, I think, because she felt like she'd been told in the Black community, what does that mean in terms of you going to heaven?
Mhm.
Black people need to die with all their organs inside.
That's right.
So
Yes,
it was,
honey.
it was
We hear that all the time.
Yes, it's major conversation. And the thing too is that if you have this conversation prior to a tragedy, that's a lot easier conversation to go through than you're at a tragic moment. Everybody is emotional. It's much more difficult to talk about. And it's wonderful when you have somebody like Bobby who can come in, that's objective, that can come in with a soothing tone, that's very educated. So organizations like LifeLink, I think, mean so much to us, just as pre-education, so that we have this discussion long before we are in the moment.
I agree with that. Especially, I think having these conversations, but then also, because for me, everything comes back to education. People don't know what they don't know.
Mhm.
And I think if people understood the impact of donation in their communities, or how transplantation affects people in their communities, when it's time to consider donation, they may say yes because, again, it could help someone in their community. I think if people understood how many, so, I'll just throw out a couple of facts. Like in the state of Georgia, there are about 3,800 people on the transplant waiting list right now. And about 2,600 of those people are African American. They're Black. So I think that if people, if the people in our communities understood that, along with the facts about organ donation, such as, if you put it on your license, that doesn't mean that, they're not going to save your life. When people have the truth and then they understand the impact that they could make, I think that makes a big difference.
Mhm.
And what can we do to spread the word? I have members who are watching. We have a whole Atlanta cluster of Links chapters who are watching. What can each of us do to spread your message? Or just one thing that we can do by next week?
I always tell everyone, talk about it with your friends and your family. Make sure your friends and your family know your wishes. It's a difficult conversation to have, talking about death and dying, but if there is one thing that is for sure, we are not going to live forever. So people should share their wishes with their friends and their families. I joke around with my family and I tell them, if I can donate donate everything. And if I'm in the position to donate and you guys say no, I will come back and haunt you for the rest of your lives, opening cabinets, closing them while you're sleeping. But there's so many people in our community in need. And it's not even about death and dying. You can be a living donor. We have 2 kidneys. There are so many people in our community who suffer from hypertension, diabetes, and those are the 2 leading causes of chronic kidney disease. You can live healthily and a long time with 1 kidney. So those are the things. I would just discuss that with your friends and your family.
Lavette and then Bobby.
Well, I absolutely concur with what Morgan has said. I've had, of course, so many conversations with my friends who have then spread it out further to have with their friends. But this really started too when Michael needed a kidney because you can get a living donor. I had conversations with everybody then because I'm thinking, clearly, I don't want my husband and the father of my children to go anywhere. So anytime I could have that conversation, I did. Where I am now, I am a lot fresher off of my transplant than Bobby or Morgan. It's been only 2.5 years. And for a lung transplant, the recovery is really difficult, especially since I have other issues that come along with it because of my autoimmune issue. So only the last maybe 3 months have been my best months in the last 8 years or so. So I am now, and with COVID being lifted some, I'm ready to get out. Bobby, I'm telling you now, in public, I'm ready to get out and get on the circuit and do whatever I can do through LifeLink to talk about how important it is. Because to me, people can talk about it, but it's a blessing to have Bobby and Morgan and myself where we are standing living examples of how it has given us new life. So that's my big passion going forward, is making sure that I am very open and I talk about it as much as possible.
And if I can add, I mean, I think what Morgan and the vet said, those are the ultimate 2. But I'm going to flip this just a little bit. Is that it's also vitally important that we talk about healthy lifestyle so we can prevent the number of people who are in need of transplants. And that is one of the biggest things that we have when you say healthy lifestyle, going to the doctor, taking your medication, not taking it until you feel better, but taking it till the doctor say you don't have to take it anymore. And those are the things that, I think that's really, really, really important because as Morgan stated earlier, one thing that we do know is that we're all going to leave here somehow, some way. And so that opportunity to be a donor is always going to present itself. You may not get to hear the information, but it's going to present itself. But on the other side, we have to do a better job of being healthier and living healthier and changing lifestyles. I have a good friend who's a pastor in Atlanta, and I spoke at his church a couple of years ago, and I brought up the question of when we're at church, why do we always serve the same thing? If it's food, it's free food. We always serve fried chicken, and we all know the menu when we at church. So I challenged him. I said, Pastor, I challenge you to not serve fried chicken, but do it baked, grilled, or just change your menu. And I went back a couple weeks ago, and he called me up. He said, Bobby, I just want to let you know we haven't been here for a while, but we had our first meal. And we didn't have fried chicken, did we? Everybody said nope. And he said, it's his fault. He said, it's my fault. But, and I'm just a firm believer that if we start doing it and changing what we do, people will pick up on it of how we live. And they'll say, oh, wow, Dr. Hodge is doing this. I might need to try that. She looked good to me. So I might need to try that. That's how people are. Everyone wants to look a certain way or be something. But if we don't show by example and lead by example, Morgan and I had lunch the other day, and I hadn't seen Morgan in years. And one of the things that, I'm a former football player, so health is very important to me and keep my body toned and in shape. And we were talking, and I was telling Morgan, I said, well, I'm doing yoga now. And, I said, I've been doing yoga for the past 2.5 years since the pandemic. And I didn't think I would like it, but I love it. And it was something different I have never tried before. So I will never go to a gym again. I'll just do yoga because I love it and I enjoy it and I see the benefits of my body. And so now when I talk to people and tell them I'm doing yoga, the number of my friends who are starting to do yoga now, including Morgan's, are going to start doing yoga too.
Am I?
She said, am I?
I'll do yoga with you, Bobby. I'm not afraid.
So those are just some of the things. I just think it's real important that we start talking about healthy lifestyles and those things of living better. And, you know, I tell a lot of people all the time, you don't have to go to the gym. You can do a lot of things at home and nobody will ever know. You can start with canned goods and all different kind of things that you can do. Vacuuming is exercising, changing our diet, not eating everything fried all the time, not eating so much bread. You know, all those things that we're doing, those are things that contribute to our poor health, which leads to organ failure, which keeps that number of the list. It just keeps increasing. And we have to slow that part down. And because I really believe that we can get the information out about donors, but it's not going to help if we get 500 off and we got 1,000 who join the list.
Mm-hmm. And I want to add to that eating is important too, eating healthy, but also just even if you do a little bit of exercise, just in life in general, because I tell people that my doctors have said a million times, the thing that saved me was that I was in such great shape physically. I worked out more than usual. I was a triathlete, so I raced. But I will say to you that two things. A, that helped me live through the process of being on oxygen for 8 years, which was pretty severe. And then it helped in my recovery. And all of that makes a difference. But also, I was so in tune with my body and the health of it that was one of the indicators that I got back. I was training for the Honolulu Marathon, and I recognized that my racing times were getting slower instead of getting better. So I trained for 9 months, and I should have been getting much faster. And I did up until a point, but I knew that something was wrong because I recognized my body and health, which was great. So it put me in front of the situation instead of being really behind, which could have been tragic.
I'm going to ask a question of Bobby. We always try to go through some certain questions. Now, does it cost you anything to donate your organs? Does family incur costs for it?
There is no cost. There is no cost at all. The organ here in Georgia, LifeLink covers all of those costs of the donation process. And, you know, that's one of the questions that we do get a lot. You know, families say, well, you know, I'm not going to donate. It's going to cost. You're going to take money from his estate or her estate. And once we share that with them, it's like a breath of fresh air of letting folks know that there's no cost to be a donor at all.
What's another common question that you get in your line of work about organ donation?
Well, the number one question I get is of healthcare, is that many people are afraid to register because they're afraid if they're in an accident that their life is not going to be saved. That like someone's out there going to pick up their drive, like, oh, they're an organ donor. Let's not save their life. Let's let them be a donor. That has number one. That has taken over. It used to be my religion. But I think we've conquered that because there's so many ministers who are on dialysis and they're in need themselves. And so sometimes when you see your leaders in need, it comes, you know, we get it a little bit, but not as much as we used to. But the number one is about we say it's a mistrust of healthcare.
Mm-hmm.
And the mistrust of healthcare goes back a long.
It does.
Yes.
It sure does. It's
a long time, from the Tuskegee experiment to things that continue to have us not feeling that your physician is not, you know, has your best interest at heart. But
you know, that goes back when you ask Morgan the question about policies and those different kind of things. Those are some of the things that from the donation and transplantation side that we're trying to really get a handle on, because there's a big disconnect between, you have your OPOs doing education, but we don't see a lot of healthcare institutions doing education in the community as well. So you have these folks just coming in, and, you know, I do some work with Morehouse, and I was sharing with some of their students a couple of weeks ago. It said, when you guys become physicians and you're licensed and you got your practice or whatever, get out in the community. Don't just do everything in your four walls of your institution. Get out in the community so people can have a trust in you and saying, well, wow, she's a doctor, she's doing this, maybe it's not that bad. So I think there's a big disconnect as well.
There's a quote that I live by, and I always use it when we talk about health equity, whenever I hear maybe my physician colleagues talking about being able to connect with different races. And that is a quote by Theodore Roosevelt, which is, people don't care how much you know until they know how much you care. Like, you can talk to a patient and beat them over the head about what they're supposed to do, but unless they know that you care, that you truly care about their best interest, it's just all noise. It's all noise. So that's just something that I think is really important. Like, people want to know that their healthcare team cares for them, that it's not just about taking something away from. As you mentioned, Bobby, you can't. Well, you didn't mention it on this call, but when you and I were speaking last week, you made a statement about people in our community feeling like we're taking something from them, like asking them to be a donor without pouring into that community. And so it kind of just goes back to, if people know that you care about them, they're probably going to be a lot more willing to say yes to giving something of themselves, if that makes sense.
No, I think it totally makes sense. I mean, that's sort of the buzzwords in healthcare now, are patient-centered outcomes and trauma-informed care, that we're doing a better job, not just looking at whether you lived or died, but what is your experience?
Right.
How come you didn't trust me? How come you did trust me? What did I do wrong? What did I do right? And educating all of our staff, whether it's from not just the physicians, but the nurses, respiratory therapists, the dietitians, the housekeepers, security, everyone in our staff is giving culturally appropriate, non-biased care. It cannot just be one pillar. It has to be everyone kind of pulling in the same team, going in the right direction. So I think definitely legislation is the way to go, and putting our feet to the fire. It should be part of your certification. I mean, to be honest, to have a transplant, that you have to do outreach in the minority community. It should be less, or otherwise you're not considered center of excellence, which is a big
That's
deal.
right. Well, listen, that's great. That's, look, I have, yes, that's in my notes.
That definitely
writing a letter to HHS as we speak. So yeah,
I mean, definitely those, at least in the trauma world, we're thinking about that more. Is looking at the term is now trauma-informed care and patient-reported outcomes, but definitely having it as part of your certification should be there. It's good healthcare. It's good for everybody. Cultural competency is what we're supposed to be about. I do agree we need to get more in the community. I think now that COVID is hopefully getting a little quieter, we can have more things to get out in the community and see that, hey, that's your physician, that's your nurse practitioner, that's your physician assistant. They look just like you.
Right.
I'm going to the store and I'm getting my baked chicken. I'm doing some yoga. I'm right there with you. So I think that definitely, eases people's, perceptions about the healthcare system, knowing that you also are human, and talk to people that, you have a life outside of medicine. I think, and ask questions that people ask you all kinds of things, but if they feel comfortable, they're going to ask you. So I think just having that trust for your physician. And again, I tell all my patients, you're paying us. I get paid the same whether you ask me a question or not. So ask.
Right.
The patients are our customers. So don't just go to the doctor's office. Don't ask any questions. They're just going to say, okay, write in your chart, and then move on to the next one. So just like your teacher, they're going to get paid the same whether you ask a question or not. Ask your healthcare providers, your physicians about questions about your health. Be a partner about your health, which is kind of what I also try to empower us about too. Don't just feel we're not just taking from us, but also challenge us. If you don't understand, ask. As I said, there's nothing dumb about, asking about healthcare. When I go to Home Depot, I'm very dumb. Very little Home Depot literacy. I'm like, what is the thing?
I think that
so patients ask me what the pill does. Same thing.
Yeah, I think patients, I don't know. I have to, if I think from a patient perspective, I think it can be intimidating sometimes. And I think if we consider health literacy and you have someone that doesn't really understand, because navigating the healthcare system, especially when it comes to transplantation particularly, you could be the most savvy person and it's difficult.
Mm-hmm.
And if you don't have an advocate, it's hard. And I find that people maybe are sometimes intimidated, they're in shock, or they just don't know what to ask.
Mm-hmm.
So I hear you too, Dr. Hodge. This is just what I'm thinking from a person going through organ failure and in the realm of like organ donation and transplant. Sometimes those patients are just in shock, and you have a lot coming at you when you are faced with life and death. And now your life is in the hands of someone else.
Right.
It's a very, very scary situation. But that's why we do the work that we do. That's why we're here. That's why Bobby's here and Lavette is here. And we have you, Dr. Hodge, moderating this panel so that people are empowered. Hopefully everyone that's watching feels empowered and empowers the people around you. Because I think the biggest thing, Dr. Hodge, that you just said is it's advocate for yourself. It's okay. And I think people need to understand that there's no dumb question. This is your health. You pay the healthcare team. Ask as much as you can. Yeah.
And definitely, I always say, bring somebody with you if you can.
Yes.
Yeah.
Sometimes I tell patients they have to have their mom on the phone. That's fine. Sometimes they will trigger you to remember, ask this question or write stuff down. Now with the electronic record, you can send they can send your doctor a message.
Right.
Which is great. Yeah.
Send a message, or I need a refill. So you don't need to talk to anybody if you're scared to talk to or interface with. Just type it. Everyone can type on their phone. Type a message. So I think those things definitely have helped patients. At least accessibility to their healthcare team is a lot better, because now it's like 24/7 access pretty much. There's usually a nurse advice line that you can talk to, who could also answer questions when your doctor is not available. So those things I think have helped. Video visits definitely have helped in some areas of what blessings COVID has brought us.
Right.
It definitely has forced us to have more video visits available secondary to COVID. We weren't ready for it. I'll say that much. But we're getting much better at it, what we can do with video and electronic and everything else. So I think that's also an important avenue you can use to ask, talk to your physician. It could be a video visit or a telephone call.
Yeah.
I want to show one quick slide about resources before I forget. We're toward the end of the thing. This has all the links to programs that we're talking about. National Kidney Foundation, which Morgan is working with, LifeLink Foundation, Donate Life America, which is specifically looking at improving organ donation, the health of donors that we actually give to transplant organizations, that we have our medical care better keyed up to take care of those donors that we eventually go to transplant. Diabetes Association, American Liver Association, American Liver Foundation, National Marrow Donor Programs would be the match, and American Lung Association. These are all things you can look up, Google, and learn more about what they do to kind of help us go forward with increasing organ donation. Now, I'm going to ask everyone a final thought, and I will start with Bobby. Couple words to leave us with and our audience with.
Sure. But before I do that, I do want to apologize. I misspoke earlier. I called you guys the wrong chapter. You're the Camellia Rose chapter. And I work with all of your chapters here in Georgia. And now I'm doing some work with your national office. So I get a little confused. So I do want to apologize for that mistake.
We're all sisters. So that's also a great chapter.
Now, my final words that I want to say thank you guys once again for putting on this awesome program. And it takes organizations like yourself to step out and be a leader when you start talking about life issues. But in closing, I always say that if we sit by and do absolutely nothing, 0 lives will be saved. So please, please consider to becoming an organ and tissue and eye donor, because the life that you save today could be the life to save your loved one tomorrow.
Ms. Levette?
I mean, I can't say anything much more than that. I mean, that covers it all. But if you are sitting here listening tonight, pass this along, not only the video, but also the conversation to at least 5 people, and then ask those 5 people to carry it among their family to 5 other people. And just to be an advocate, not only for thinking about yourself, but thinking about others and thinking about our community and thinking about life.
Morgan?
I just want to say thank you to the Camellia Rose chapter for putting this together. I think the more that we talk about this, and as Bobby and Levette have shared, the more that organizations highlight and amplify this issue, I think the better it is for our communities.
Mm-hmm.
So to everyone that's listening, I'm going to echo my co-panelist and encourage you all to, if you're not a donor, put it on your license, share your wishes with your friends and your family. And you know, if you see someone that is in need of advocacy, empower them, but you can be their advocate too. Thank you all so much for listening to us this evening.
I want to thank all of you for being so honest and transparent about your transplant journeys and sharing with us the intimate details. It just makes everything so much more real when you can see a personal example, rather than me talking for an hour about, oh, organ donation, oh, that's nice. But to have a face, people who've actually received the gift of life, just brings it all home, and just makes us all work harder, spreading the message. So I thank you for your time. Thank you for sharing with us. Thank you, audience, for sharing with us as well. Please look at our resources, share this video with your friends, and have a wonderful evening.
Thank you.